Good afternoon. This is Cynthia Kanaki with the ALS Association. I want to thank you for carving time out of your afternoon to join us for today's webinar. This series of webinars is designed to bring information of a practical nature to those living with ALS. We cover a range of information related to nutrition, respiratory issues, mobility challenges, insurance. Today's topic is quite timely in nature. We've had many questions come across our desk related to intimacy during a journey with ALS. And fortunately, we have someone with great expertise to share that information with us today. Just a few housekeeping comments prior to the launch of our webinar. The webinar is being recorded for your post-live presentation. We'll post the recording of the webinar along with the associated slide deck on our als.org website. Give us about 24 hours to get that posted for you, but it certainly will be available for you to access post-live presentation. We also invite you to participate in the webinar by posting your questions or comment to the question box. I may answer a brief technical question immediately, or I may share your question with the full audience during our Q&A session. As an added feature to today's webinar, we have a brief 3-question survey that will appear immediately after the close of the webinar. This is an anonymous survey, but we ask you to kindly participate and share your info with us so that we can design these to be valuable to you. Let me take just a minute to introduce today's speaker. Joanna Nunez is a licensed clinical social worker with 13 years experience. For the past 11 years, she's been serving families living with ALS with the ALS Association North Carolina chapter. Joanna, I believe you are already on our call and your slides are lined up, so I will turn over to you.
Yes, ma'am. Thank you so much. Just bear with me as I share this, and we will get right into the webinar. Same page as Cynthia's, so I'm just going to go right into my introduction. Cynthia said, I'm Joanna Nunez. Just Joanna is fine. I have been with the ALS Association since 2012, and we were just mathing before this, and I realized that's 11 years now. I've been telling everybody 10 years, but June 2012 was my start date, and that's next month. So I'm officially going to say 11. I was basically just a support group facilitator. We have a wide state. I don't know if that's a great way to say it, but we have a large state, and I live in the Fayetteville, North Carolina area, and we didn't have anybody there, so I was happy to take on that task. And then as you will hear, I like to talk, so I became a facilitator for many more support groups. And then in 2020 we added a new clinic to our 6 existing clinics in North Carolina, and it is in Wilmington, North Carolina. If you know anything about the state, Fayetteville is the closest to Wilmington, so from where everybody else lived, so they made me a care services social worker, and we kind of haven't looked back from there. I've added a second clinic to that since that time, and I occasionally fill in telehealth wise with the Charlotte clinic because that's about 3 hours from me. But great teams, all of us. I can say that even though I'm a member of the team. I have nothing to disclose. I'm not getting paid for this. I'm not selling anything. I do want to point out that I am not ASEC certified. ASEC stands for the American Association of Sexuality Educators, Counselors, and Therapists. I was on that path in about 2014, and then I found out it is 600 hours to become ASEC certified. And I thought, well, for that amount of time in college, I could just get a PhD. And I did absolutely neither. But I've had many CEUs in this. Intimacy with across all of the populations I serve is very important and tends to come up in counseling. So I feel like it's important, but I can't throw that ASEC at the back of my name in my alphabet soup. So just wanted to point that out. I've presented very similar topics. I'm trying to constantly update the slide deck as we get more information. at the 2022 MND Alliance of Professionals and also for the Greater Chicago area earlier this year. Oh, sorry, I meant to say, let me go back. Oh, wow. Yeah, I'm not a techie. That will be proven throughout this slide show. I have a huge thing here and I missed it. It says disclaimer about my humor. I'm a pretty humorous person. I picked an ice bucket challenge picture from like circa 2014 to show you guys there. That's me. The reason I want to put a disclaimer in this is because I would never want anyone to think that I am laughing at you or at your situation. I feel like I deal with humor to deal with all of the trauma that I work with, both in my ALS clinic and in my private practice. So you'll hear some jokes. You'll hear some kind of funny remarks in here, but please know that I take this very seriously. But I kind of feel like if we're not laughing, we're crying. So I strongly encourage humor in my private practice. My entire family's military. If you know anything about the military, you know they can have kind of off-color humor. So I promise not to bring any of that to this presentation today because I think my bosses are listening. But I kind of have a crazy sense of humor. I'll keep it professional, but I just wanted to give that big warning because again, I would just never want you to think I'm laughing at you or at your situation. All right, so now moving on. You can't do a presentation without defining what you're talking about. So if we look at the Webster's definition for the word intimacy, the exact definition is the state of being intimate. Now, I don't know about you, but if I had written that on my paper in 3rd grade, Sister Margaret Mary would have given me an F because you never define the definition with the word. So of course I jumped over to intimate, and Webster's defines intimate as marked by a warm friendship developing through long association, or suggesting informal warmth or privacy, or engaged in, involving, or marked by sex or sexual relations. Now that's what most people think of when we say intimate, right? That third one, the engaged in or marked by sexual relations. But you can say an intimate table. You can go to fancy restaurants and they'll say, do you want an intimate table? And all that means is it's usually a small table meant for 2 people. You can say, that's my intimate friend, and be talking about a friend that you don't do anything sexually with. They just know the ins and out of your life. So in this case, we're talking mostly about the sexual intimacy definition, but we'll get into that about how we define it and how you might have to change your definition of intimacy as we go through this slideshow. So I gave you the Webster's definition. That's for like the nerdy brainy people. We just asked some adults, how do you define intimacy? If I come up to you and I say, what is intimacy to you? And this is what just the general average adult said off the street. They said sex, love, being able to understand someone without speaking, and knowing what my partner needs. So I like those. Then we asked high schoolers. I have a friend that teaches 10th grade English. So I asked her, can you ask your high schoolers, what does intimacy mean? And she said, they said, like doing it, ? And going steady, going out, being exclusive. That was how they defined intimacy. Finally, I have a cousin that works in a preschool. And I have a feeling they would not know what intimacy means. And I have a feeling parents would be very mad if he asked them to define intimacy. So I asked him, can you ask little kids what love means? Like, what does being in love mean? And this is what they said. And by far, these are the best definitions of intimacy right here. Okay. They said, giving the person you love all of your gummy bears, even the good ones. Letting her pick the toys first, crying a lot, and holding hands and maybe kissing when no one is looking. So we have some very different definitions of intimacy, and I think they might all play into this. I throw this into my presentation every time. This is a picture of Carrie Brown Still and her daughter, who was 10 months in this picture, her daughter Kellen. The reason people kind of go, well, ALS and intimacy, like, you're not going to talk to me about sex, right? Like, you're not going to talk to me about conception and preventing conception. And this is what I need to tell you. ALS doesn't inhibit conception, pregnancy, or birth. So if you're on the younger end of a diagnosis, and we have seen these more and more, unfortunately, you of course can still get pregnant, you can still conceive, you can still give birth while you have a diagnosis of ALS. Carrie was born in 1979. In 2005, she developed foot drop. She was 26 years old at the time, and her right foot, which was her predominant foot, she had a foot drop, and many of you might know what foot drop is. She was, of course, misdiagnosed at that time. Nobody was thinking a 26-year-old had ALS. She was misdiagnosed with just temporary paralysis. In early 2006, so about 8 months later, her foot movement came back. And that was the end of it. No one thought anything about it. She found out she was pregnant a few months after getting her movement back in her foot. But then 3 months later, towards the end of 2006, she was officially diagnosed with ALS. She carried baby Kellen during her diagnosis, and baby Kellen was born in 2007. At that point, Carrie was already wheelchair bound and pretty immobile and had lost most of her speaking capability. She passed away, unfortunately, in January of 2008 at the age of 29, and Kellen was 10 months old. This picture was taken about 2 months before she died. So I always, and going to the walk, seeing more and more younger people being diagnosed with this. I've seen more pregnant people. I've seen fathers with ALS still able to procreate. So please know that if babies are in your future and you have this diagnosis, your neurologist, your OBGYN, your urologist, they can help. They are happy to help to make that still a reality for you. So let's get to why we're here, right? Let's talk about sex. So before I jump right into sex, one of my coworkers heard me kind of rehearsing this for the MND conference in San Diego in 2022. Her name's Lily. She did an awesome presentation about kids in ALS there. So we were running our presentations by each other. And I was also giving another presentation about a week or two later, and I got my presentations mixed up. Okay, if you know Joanna, this is a very Joanna thing to do. The MND conference only wanted me to talk for 15 minutes. And I had given them like a 40-minute presentation. And I figured this out, luckily, about a week before the presentations. And I went, oh no, I like really have to cut my MND presentation down because I only have 15 minutes. So the first thing that we pulled was the butterscotch pudding story. So hopefully Lily can hear my butterscotch pudding story because she said she really liked it. And all that to say, when I was a little kid, I'm a chubby kid here, okay, so I really liked desserts. And if you're in America, you know that pudding is kind of like the picture of Jello pudding that I put up in there. If you're international, like in England, they call pudding, all pudding is like dessert. So you could say, I want some pudding, and they mean cake. But I am talking about the American version of pudding, like the picture demonstrates, okay? So I'm this fat little kid that lives for dessert. All right, you just got to get this visual. Like, she's going to eat all her green beans, even if she doesn't like her green beans, because I grew up in the, if you don't eat all of your food, you don't get dessert. And my mom had made, for the very first time, I'm about 4 or 5 years old, she had made butterscotch pudding. And it smelled really good. And I love pudding. Okay, let's just be honest. I like any dessert. Okay, so I'm all excited. I eat my like nasty green beans, and here comes this butterscotch pudding. And I get my Cool Whip on top of it, and I take a big old spoonful of butterscotch pudding and I pop it in my mouth, and I start to swallow, and I start to gag, and I'm kind of just sitting there, and I don't know what to say. And I realized my mom and dad are also kind of making a funny face at their butterscotch pudding. And my mom goes, "Oh no, I didn't buy instant butterscotch pudding. I bought cook and serve and I prepared it with the instant directions. So I was eating lumpy, nasty, clumpy butterscotch pudding." Now, why am I telling you this? Since the age of 5, we'll say I'm in my 40s now. I don't eat anything butterscotch flavored. Why? Because that was my first introduction to butterscotch, and it was a negative one. Okay. I don't like butterscotch flavored anything. Those dipped cones at Dairy Queen, if they're butterscotch, nah, not gonna eat them. All right. So this is a really funny kind of way of saying, how did your family talk to you about sex while you were growing up? Did they talk to you about sex when you were growing up? Or was it something like, no, your father will talk to you about that when you get older. Or here's a book. If you have any questions, maybe they're going to bring that up in health class. Or were they complete opposites? And were they like, hey, let's talk about sex. Let's talk about how you could get pregnant. Let's talk about how you could get girls pregnant. Let's talk about safe sex. Let's talk about STDs and STIs and condoms. So you have both sides of that spectrum, right? And this influences you as an adult. And I don't think a lot of people realize that. I came from like a middle of the ground, like the middle of the spectrum. We could ask stuff, but my parents were more like, here's a book. And then, by the time I was in high school, Google was a thing. So we got our sex education from Google. But if you were taught based on your culture, based on your religion, that you couldn't talk about sex, how comfortable are you walking into a doctor's office, whether it's your ALS doctor, like your neurologist, or your primary care, and mentioning sex, right? If there's a problem, can you bring it up? If there's not a problem, do you even need to bring it up? And what I challenged the doctors and all the professionals at the MND conference was, if your patient is not bringing up sex, are you bringing it up with them? Because sex is an important part of life. And my first thought probably wouldn't be about sex if I was given an ALS diagnosis, but I guarantee in the first few days after the diagnosis and digesting all that information and research, I would be thinking, wait a minute, how are we, I'm married. How are we still going to do this? So I throw a picture of Sue Johansson, sorry, she's a Canadian woman, and she was a nurse educator. And she used to have these shows, and all I remember is they came on very late at night, and I was not supposed to watch them. So of course, I tried to. But she just says sex is perfectly natural. It's something pleasurable, it's enjoyable, and it enhances a relationship. So why don't we learn more about it, right? Like everyone talks about communication in couples therapy or partner therapy, and money and intimacy should be right there with that, because if you have different views on sex and intimacy, that could cause a lot of problems in a relationship. So I wanted to do some research and find out, okay, I know the biologics, I can go to the doctors, I can ask about like doing it with ALS, but what have we learned? What have the studies been about ALS and intimacy? Because let's look at this for a minute. If you are the person without ALS, if you are the primary caregiver, you wear a lot of hats. And you might not be in a relationship with your caregiver, or a coupled relationship. They could be your parent. They could just be a good friend. They could be an adult child. But specifically looking at caregivers that are also a partner. Whenever we throw that cows into our list of titles, it really kind of dominates all of our other relationships with that person. So Charlie Wren, who was featured in a recent PBS documentary about ALS. His wife, Angie, is his full-time caregiver. She's also his wife, but notice that I said, full-time caregiver. She's also mother to their children. She's a mother to her stepchildren that Charlie also had when they got married together. And she was a working woman for a long time, even after his diagnosis. But everything else, if you speak to Angie, and she's open and candid about this, so I'm happy to share some of her story, caregiving comes first. She's a wife and a mother and a lover and a friend, but caregiving Charlie comes first, and it is a 24/7 job. So we as professionals have to look at it and say, Angie, when you and Charlie come into clinic, how are you having that aspect of your marriage and of your relationship? Because if you're his nurse caregiver for 24/7, 365, when do you get just to be his wife? Then we also have to look at from a pals and a cal's perspective, what necessary functions need to be performed for quality of life for our pals, right? So if Angie says, or any caregiver that's in a partnered relationship to their person with ALS says, dang it, we have not had a date night in months, maybe years. So I'm putting my foot down, and Friday night we are going to have a movie night. And it doesn't matter because you can't go anywhere. You're in a wheelchair. We are having a movie. I am picking the movie. We are going to sit here and watch a movie together. I will throw some beer into your feeding tube, and I will pour a glass of wine and have that. And dang it, we are just going to have a movie night Friday night because that's what I need. That might be the caregiver's need, right? And I wouldn't blame them one bit, because having a dateable, fun relationship, even if you've been married for 30 years, is important. But what if halfway through that movie, we need to pause it and suction our persons with ALS, provide suction? What if they start coughing and we need to pause it and throw on their cough assist and help them cough? That's what I mean when I say it kind of trumps all the other titles in our life. And unfortunately, it's almost like being a first responder. If you've ever been in any kind of relationship, a friendship, a dating kind of a relationship, or you have a child that's a first responder, that's they're called first responders for a reason, right? It doesn't matter if it's the family cookout or your 50th wedding anniversary. If that pager goes off and they are told they need to respond to a fire because they're on call, or they're a police officer and they're told they're needed, all hands on deck kind of thing, they go, because that's their first title. And I think that's sometimes what happens with our caregivers. They put that caregiving title first, as they should, for the quality of life for the pal. But then we have to look at, what does the caregiver need? And quite honestly, what does the pal need to have a good quality of life, right? So I don't know if any of you have researched this, but spoiler alert, there are not a lot of studies done on ALS and intimacy. I found 2. Okay. I found like about 28 entries, but when I actually started to go through the journal articles and look and see what they said, it boiled down to 2. And I've got their work cited at the end, but Goldstein and his colleagues did a few studies. The first thing, I'm not going to read it to you, I'm going to say it to you in English. The first study showed that the more involved in actual caregiving you are, the less intimate you are. So kind of what we were talking about, right? We can be doing something intimate, but if something is needed, we jump right to our caregiving role. And also, if you're the caregiver, you might be tired and you might throw intimacy really far down on the list because you need sleep first and feeding first and a shower first. And your pal needs all those things too. So sex, we don't have time for that. Holding hands on the couch and watching a movie together, that sounds great, but get back to me in like 2 years and I'll try to pencil that in. A second study, just we were looking at stress, or they were looking at stress, and they showed that the biggest factor in how this relationship is going to go is how was the relationship before the diagnosis? Okay. Were you about to separate before your partner was given the news that they have ALS? So you decided, let's not separate. I said in sickness and in health, so I'm going to stay there for them. And there is absolutely nothing wrong with that. And I actually know I have a couple clients in my ALS clinics that are in that very same situation, and my hats are off to them. But those clients, those pals and cows, I would not expect them to be as intimate as, say, somebody that just celebrated their 30th wedding anniversary together. They were looking forward to retiring to Miami, and one of them just got the diagnosis of ALS. That's what Goldstein's second study showed. What does your family relationship, what did your intimate relationship look like before the diagnosis came into the picture? I have a story, and if I only use first names, except for Charlie and Angie, since they're kind of public celebrities now. As I said, I did the support groups, and I still do the support groups. And since COVID, we, of course, everything is via Zoom, so people enter their name however they want to. I think I'm Joanna N on this. And one lady came into our support group one day, and she just had a first name. And I didn't want to pry, so we did our support group. She spoke up here and there, but she never really went into her story, so I never said a word about it. And she attended like every couple of weeks. She'd be in all of my different support groups. So I finally private messaged her and said, like, thank you so much for attending. I just wondered what your relationship with ALS is, because I only have a first name, so I can't really look you up in our records, and I wanted to know how I could support you more. And she messaged back and said, my husband's name is Kevin blank, Kevin last name. I am his ex-wife. We have 3 grown children together, and I just want to make this journey for him and his new wife as easy as possible. But I also want to be able to talk to my children, because I know they're going to have questions. And while he and his new wife are doing a great job with this, my husband and I, so they were both remarried, my husband and I want to be supportive of Kevin and our family as much as I can, and as much as we can. And I just thought, like, that's amazing. Okay. This woman is taking time out of her week, and she actually owned a business, so she was a very busy woman, to attend these support groups, to ask questions and just listen and kind of get inside tips from other people that were going through this process, to talk to her very young adult children, like they were all like 18 to 21. So to me, that's still young. About their dad and what he was going to go through. And then she also wanted to be supportive of his new wife and the life they were building. So Kevin's story, that just blows me away. So please remember, Joanna is not a doctor. She is a licensed clinical social worker, but she has had all these reviewed by a doctor. And actually my whole clinic team in Wilmington reviewed this before I went to present at the MND conference. So I spoke directly with OT, PT, and respiratory. And of course, Dr. Greer and Dr. Hommel at the ALS clinic in Wilmington, North Carolina. So someone has been diagnosed with ALS. They are in a partner or partnered relationships. And I'll get to the no judgment in a minute. But, like I said, 3-4 days after the initial shock wears off, you might be thinking, hey, do I still get to have sex? So directly, how does it affect you? Well, we know ALS affects nerves and muscles, right? So what does that mean? Your brain tells your body, hey, go put your arm on your partner's thigh. Well, your brain's telling your body to do that, and your muscle wants to do that. But with ALS, the nerves might not be firing, and you might not physically be able to do that anymore. a lesser extent, voluntary nerves and muscles are also engaged during sexual activity. So we have our involuntary muscles, right? Like we breathe. We don't have to remind ourselves to breathe. Thank goodness. But we, like I said, we have to tell ourselves, hey, go put my arm on my partner's thigh. My brain is telling my arm that. If I can't do that, how can I stroke their thigh, right? So that would be where, can I tell my partner, hey, please move my arm onto your thigh? And you know what? We have patients and partners that do that. And I think that's wonderful. So that's one of the big things, is sometimes you have to have your partner do a little caregiving there, unfortunately, and have them kind of move you how they want to be moved, and move you how you want to be moved. The only other issue kind of with nerves and muscles is many of you with ALS present and endorse with a lot of muscle spasms and muscle tightness. So this just complicates things. If your legs are already spasming and tight, that can put a damper on how are we going to be intimate tonight if I'm already kind of in pain, or, you know, we're spasming. That's something you can easily talk about with your OT, your PT, the doctor. They can talk about, hey, maybe we need to look into a muscle relaxer that you take certain times. Respiratory, obviously, is a big issue with ALS. I kind of referenced this earlier, but people, especially caregivers, right? They're worried. They don't want to hurt the person that they're with. So they're like, can I still lay on top of my person, or will that crush them? You know, will they not be able to breathe because they don't have the arm strength to support me anymore? Can they lay on top of me? Or is that going to be too awkward of a position? Will they not be able to breathe? What if, can they take their non-invasive ventilator off during sex, or do they need to keep it on? I mean, that's important, right? Sex is cardio. Sex is sometimes the only cardio some people are getting, bless them. So if you're doing it right, your heart might start beating a little faster. We don't want you to go into a breathing situation where you're not getting enough air. So that would be a totally appropriate question. Hey, do I keep my Vivo on when we're having sex? And if your respiratory therapist can't answer that, they should know how to answer that. They should be able to find out for you. And it shouldn't be a judgment thing, because we all know you're adults, you're having sex. We want to have you have safe sex. It's just a different kind of safe sex when we're looking at ALS. I think, honestly, the indirect effects of ALS stop sex, stop the physical act of sex more than the direct effects do. We're tired, right? Everybody is tired. The Cal is tired. The Pal is tired. And let's just throw this out there, because I realize that I'm speaking about, even though I try to be super inclusive, I'm speaking about couples mostly, right? Like a caregiver and a pal that are either married or in some sort of intimate relationship. But I have plenty of single people with ALS that come to the clinic, and I don't want to crimp their style. I got a guy in his 50s that goes to one of my clinics. I'll be very vague so that I don't out him. He has got like 6 different girlfriends. And his biggest fear when he got to know me and got to like get that I was, I guess, cool and we could talk about stuff, his biggest fear was getting a caregiver, because he didn't want a caregiver to mess up his flow. That's exactly, he's like, if I go and see Anita on this weekend and then I go see Brenda next weekend, if I've got a caregiver, I got to get somebody that won't tell Anita about Brenda. And I'm like, dude, I've got you. This is a problem. We got to find you somebody that can keep their mouth shut. That's important, right? So if he's fatigued, he can no longer, and he covered the state of North Carolina, man. I'm not judging. I'm damn jealous, I would say. You know, he would be in Raleigh this weekend with somebody and he'd be in Charlotte next weekend. Well, he can't do that anymore because he can't drive. So does he have a good enough friend that will hop in the driver's seat and take him to visit his girlfriends? If not, then he's going to have to reevaluate, and that's some of my role, as the social worker, how this is an important part of your life, and we are not trying to take that part of your life away. So do we get the women to come to you? Like, how, let me help you, dude. We're going to figure this out together. Then we've got the lack of sleep, right? Nobody sleeps good when ALS is involved. The person with ALS wakes up a lot. The caregiver wakes up. If the caregiver is the partner or one of the partners, there's an issue right there. Nobody wants sex when they're tired. The muscle tightness and weakness, I kind of talked about that before. It's indirect, it's direct, it's a problem. And honestly, medications can be an issue. So this was very important. I'm going to skip ahead and I'll go back. I added this slide like 2 weeks ago because this just came up in my clinic. We had a person in there, a married couple, heterosexual relationship, and one of his first questions, and good on him for asking about it, was Dr. Greer wanted to put him on all three, right? All three of the R medicines, Riluzole, Relivrio, and Radicava. And one of his first questions was, do these cause erectile dysfunction? Because we have an active sex life. And she looked at me. She knew that I do these presentations. And I said, those are not in my known side effects. I kind of try to keep up with the ALS drugs from a social work perspective, but let me double check. And the good news is no. None of the three, as I like to call them, the 3 R's, have a known sexual side effect of erectile dysfunction. That also, let's throw it over to the ladies, the 3 R's do not mention any kind of vaginal dryness as a side effect. Now, here's my caveat, okay? I'm not a doctor, but as a consumer of medicine, I will tell you, I have called doctors in my past and said, like, hey, y'all put me on this new medicine and I have this weird rash thing going on. It's not a problem, but is it going to clear up? I Googled the side effects and I don't see it listed. And what my doctor told me was they only have to list it as a side effect if more than 6 to 7% of the test population got it. So what that means is 3% of the population could have gotten the same rash that I have. But because only 3% got it, they don't have to list it as a known side effect. So if all of a sudden you are getting erectile dysfunction or vaginal dryness, and this has not been an issue for you before, and oh, surprise, you just started Relivrio 2 weeks ago, I would absolutely question, hey, is it the Relivrio that's causing this? And throw that out at your doctor. And you know what, Dr. Greer, she was happy to, she said, we don't know of any erectile dysfunction based on the 3 R's, but if that becomes a problem, I will write you a prescription and we will make sure that we handle that. And I know she has that same attitude towards any feminine problems like vaginal dryness that might happen. And she wouldn't blink an eye. And like, I have to say, I was kind of proud because if you know anything about North Carolina, we're like the deep South, and sometimes that's like not polite to bring up sex. So for her to just answer his question without batting an eye and making it seem like it was the most natural question in the world, because what did I say earlier? It is. It's part of life. I was like so proud to be part of that clinic. Like, yeah, you can ask us our sex questions and we don't even blink. So going back to that, let's look at the partner for a minute, right? And again, even if your partner is not your main caregiver, okay, maybe your partner still works. So you have like a hired paid caregiver that comes in. Maybe your main caregiver is an adult child, but you still have a partner or partners. Even if they're not caregiving, they're dealing with their anticipatory grief, right? As much as we don't like to say it, we know that that scary 5-letter word is attached to ALS, unfortunately, right? Like death. And a lot of us are wondering, how much time do I have? How much time does my husband have? How much time does my boyfriend have? My girlfriend, my partner, my mother, my father. And unfortunately, that's a question nobody can really answer because ALS is so vastly different in everybody. So we're dealing with our own grief. And studies have shown, and this is not ALS specific, studies have shown it's easier to lose somebody when you're angry at them, right? So if I know my husband is about to pass, or I think he's about to pass in the next year, instinctively you'd say, wow, you want that last year to be perfect. You want to take a second honeymoon, and you want to take time off from work if you can, and you want to spend all your time together and make that the best year so you always have a memory of him. But what we've seen is, in a lot of people, that's too hard to do. So it's easier for them to be angry at their husband, and I don't even like him anyway. I'll be glad when he goes. Even if that's all a big facade, right? Because our brain's telling us it's easier to leave. It's easier to let them go if we don't love them. They actually noticed this study. This study became very popular, and what made them study it was students going away to college for the first time. And they showed that 17 to 18-year-olds would actually kind of like pick fights with their family members so they could leave on quote unquote bad terms to make leaving home easier for them, which I know it sounds counterintuitive. It's just one of those weird, like, reverse psychology things you've got to trust me on. So we've got that going on. We've got that grief and not knowing how to deal with that grief. Fear, all right? What kind of talked about this, and I don't just mean the fear of death. I'm talking about fear. Can I still sit on my pal's lap? Can we be, I don't want to hurt them. I don't want to hurt her. What if I'm laying on them and I'm too much for them? Can I even get into bed with them and hold their hand? I don't know. There's all these things now, they have a port for this, and they just got a tofersen lumbar puncture the other day. Am I going to put them in any pain? Because the last thing I want to do is cause pain to the person I love. So those are things we can talk about with the doctor. Hey, occupational therapist, what is the best position for us to be in to lay in bed together? If you don't feel comfortable saying sex to every single person on your caregiving team at your ALS clinic, throw out the whole like laying in bed together. My husband's having an issue laying in bed. What kind of wedge pillows can you suggest? I like when I visit my girlfriend to sometimes cuddle with her. What's the best position for us to be in so that we're not putting any extra duress on her lungs? I mean, throw it out that way. There's a lot of times depression going on with the partner. And that I can only say that not only is that normal, but I would highly recommend some support groups or therapy for that so that you don't feel alone and that you don't isolate. And finally, like I said, if your partner happens to be your caregiver, it's really hard to shut off that caregiving role. And we want to sometimes, but fear takes over, or our need to help takes over. So, and all I can say is talk to these people on your clinic teams about this. If somebody came to me as the ALS social worker and said, I want to sleep with my girlfriend, but I'm afraid of hurting her now that she has ALS, I'd be like, thank you for coming to me with that. Let me pull, with your permission, the RT in here and the OT in here and maybe the PT in here. So all that is respiratory therapist, occupational therapist, and physical therapist, so that we can come up with answers for you so that you don't hurt your girlfriend, but at the same time, you're still able to cuddle with them, or you're still able to sleep with them, or whatever you want to do with them. We already talked about that. So I'm hoping she's watching, or at least gets to see the replay. This is my awesome coworker, Lily Cola. I did ask permission. If you're on the internet, I don't have to ask your permission. I just have to give credit. But this was a personal picture I took of her at one of our care services retreats. So I did ask her permission, and she very thankfully gave it to me. This is a demonstration that my awesome boss, Kara, has come up with for us to do, to be more aware of what a caregiver has to go through. And we also often present it to groups of people that don't have a lot of medical experience with ALS. So we take a volunteer, and Lily was our volunteer. And then all of us shout out things that the caregiver of a newly diagnosed person has to deal with. So if you can look at this picture, you see that Lily is holding kind of an OT device, like some kind of, I don't know if it's sorry, y'all, I don't know the DME, I'm a social worker. I don't know if it's a butt wiper or like a reacher, but she's got that in her left hand. She's got a clock because she's on the time management and taking care of the whole family now. There's a little toy in her hand because, you know, if you have kids or grandkids, you're taking care of them too. She's got books on faith and money management. She's got parking for handicap. She's got Eeyore. He represents depression. And if I could do a little video, she had stuff in her back pocket. She's got a Wonder Woman headband on because, or Superwoman, because when you're the caregiver, you kind of have to be all things, right? And it's not, you don't get to slack. You don't get to take a day off in your mindset, but I tell you, you can, and let your team help you figure out how to get respite care in there. So honestly, of all these things, stress is what affects intimacy more than any diagnosis, and that's across the board. I can say that with confidence. Everyone wants to know about medications. I kind of touched about the 3 R's. Don't have any known sexual side effects. Here are some medications that you might be on. They're not medical, they're not like ALS medications, okay? But it is super common, I have seen in clinic, for doctors to prescribe either the person with ALS or a caregiver or a family member an SSRI. And all that stands for is selective serotonin reuptake inhibitor. That is a fancy way to say Paxil, Zoloft, Lexapro, the other P word, all of those antidepressant medications, okay? Those do have a known effect to lower libido. Now, Lexapro, and there's another one made by the same company as Lexapro, which of course I can tell you is Forest Laboratories, but I can't remember the dang name of the drug. But there are 2 or 3 out there that have less sexual side effects. So honestly, tell your doctor that. Be like, sure, I'll try your Paxil. How is it going to help? How is it going to affect my libido? And they can tell you. Prozac. Prozac is a sex killer, man. I'm just letting you know. So if I'm not telling you not to take a medication, if your doctor thinks it's appropriate for you, I'm telling you to ask your doctor, hey, what are the side effects? What can I do to counter? You know, if you think Prozac is the right drug for me, what can we do either naturally or with another drug to make sure I don't lose my libido? Blood pressure meds, especially beta blockers, H2s, which are like histamines, like for your GERD. So like Pepcid AC and Zantac, those can affect your libido. Opioids. Now, many of you might be on opioids. Opioids are a painkiller. I don't want you to not be on a painkiller. Please don't go to your doctor and say, Joanna, that lady from ALS in Raleigh told me not to be on opioids anymore because it's killing my sex drive. Please don't say that. What Joanna is saying is go to the doctor and be like, hey, I see you have me on hydrocodone. I'm having a hard time with, I'm having a hard time. What can we do about that? And let them work with you on some natural and maybe some not so natural ways to bring your libido back. Benzodiazepines, we call them benzos. Those are your anti-anxiety meds that are fast acting, like Xanax, Valium, okay? Stuff like Buspar, that's not a fast acting, that really shouldn't affect your libido. But Valium, yeah, it makes you feel better and it takes away that like anxiety, but it can have a negative effect on your libido and your sex drive. So we want to look into that. That can be planned. You don't, we're having an intimate moment Friday night. I will not take my Valium so that that might be one that can be planned, but I know the rest can't. Statins, those are cholesterol drugs. They are contraindicated for ALS anyway. Joanna is not a doctor, but I do know that studies have shown that there is an increased rate of functional decline and muscle cramping in ALS patients that are taking a statin drug. Statin drugs are certain drugs for cholesterol, for high cholesterol. If you have high cholesterol and you're on a statin drug, just talk to your neurologist. They'll be too happy to change into a non-statin cholesterol drug because we don't want you to have high cholesterol either. And your anticonvulsants, things that would stop a seizure, Depakote, things like that can also affect your libido. Again, I'm only telling you this because I'm trying to normalize these problems are out there. Okay, 1 in 7 to 8 people in the US are on an SSRI. Therefore, Not everybody, because remember, side effects don't affect everybody, but of those 1 in 7 to 8, how many of them are having sexual side effects? I want them to talk to their doctor about that. My last slide that I want to talk to you about is redefining intimacy. All this means is we used to have sex. That's how we were intimate. Maybe we didn't have sex. Maybe we were just getting to that point where we were going to have sex. How can we be intimate now? Maybe you can still have sex. Maybe it's sitting on the couch holding hands. Maybe it's separate beds, because sometimes, like that picture on the bottom middle, sometimes all the gear requires a separate bed. A real quick story. I had a young board member who lost her husband when they were both in their very early 40s, and he was diagnosed in his late 30s. They had children. They had been together 6 or 7 years, long enough to create a couple children. And one of the things she told us that was very important to them was that they continued to date. They continued to have every other Friday night as a date night, even when he was immobile and wasn't speaking anymore. Her set of parents and his set of parents took the kids every other Friday night, so that they could have a date night. And she said it just went from when we were younger, we would go out to clubs, we would go out to restaurants, we would go to like a fun hotel room and have sex. She said in near the end, we were sitting on the couch together, binge watching Netflix, and Dr. Bedlack had given her permission to have a glass of wine and to flatten a can of beer for him to put through his G-tube so he could still have like a little buzz going on with his beer. And that was their Friday night. And I think that's awesome. So talk to your partner and talk to your social worker about redefining intimacy. Just a quick picture that your clinic's here to help. Wanted to throw my resources out there. Sexuality and Disability is probably one of the best books I've ever read. But if you have ALS or you are very close to someone with ALS, Enabling Romance, A Guide to Love, Sex, and Relationships for the Disabled. This is written by Ken Kroll and his partner, Erica Klein. They are married. Ken he doesn't have ALS, but he has kind of an unnamed NMD. So they are really approaching it from we are living it, here's our point of view, here's how we still have sex. Those are my works cited. And I just wanted to leave it up while we talk. Questions, that's my contact info. That's my awesome care services team at that retreat where we had a picture of Lily. I'm the one with the flip-flops on, because if it's not snowing, I have flip-flops on. There's all my contact info. Unfortunately, right now, that phone number is only voice, so you can't text it. I'm not ignoring you. It's a VoIP. I don't get text. So if you need to text me, instead email me. And there's my email. And please, I know I've talked long enough. Someone ask a question. Miss Cynthia, I'm ready for questions.
Well, Ms. Joanna, thanks so much. You actually covered quite a bit of information, and I so appreciate the way you covered that, just kind of getting the 10,000-foot overview. So interesting to hear how different generations define intimacy or sex, from adults to high schoolers to little preschoolers. So kind of gives us pause to sit back and reflect about what we do in our busy day-to-day life. I invite everyone to continue to submit your questions or comments in the Q&A box. Again, that's an anonymous Q&A, so we'll be happy to answer your questions directly. You can certainly submit any questions directly to Joanna if you have a question you would like to share with her privately. I see her email address is there on the screen, so don't hesitate to do so. Or, of course, to reach out to your local ALS Association chapter care service staff. We do have a couple of questions, and some are just comments that have come across. The first one is, we still engage in foreplay, but I do all the work. Is he getting something out of it?
Ooh. So my first question as a therapist would be, and I know, and this is not tongue in cheek, I promise, is ask him, because neither of us are mind readers. But I would say like, hey, does this still feel good to you? Are you enjoying this? Either while you're in the act or just, like after dinner or whatever, like, hey, I want to be intimate tonight. Unfortunately, given our situation, I'm doing a lot of the work and that's okay. But does it feel good for you? Like, just ask, or what can I do differently? If you're in that intimate relationship, talking is important. So just ask.
Oh, so often it goes back to what you mentioned, which was communication. So thank you. Thank you. You were talking about caregivers. You spent a lot of time talking about that caregiver role. This is an interesting comment. I will read it. Not a question, but a comment. Ed's barber comes to the house once a month. I don't mind the day-to-day care, but it's nice to have someone else handle the haircut, shave, nail clipping once a month.
That's amazing that you have a barber that will do that. And I think what people don't understand is even the best caregiver in the world needs a break just to be a great caregiver. Even if you don't feel you need a break, I'm one of those people that, and this is a bad thing, don't be like Joanna. I will often go and go and go until I can't go anymore. And then I will act very surprised when I fall asleep at like 5 o'clock on a Friday and don't wake up until like noon on a Saturday. And I'll say, oh my God, I can't believe I slept that long. And all my friends and family will go, yeah, because you probably needed it. So even if you feel like things are good right now, Angie was just talking about that. Angie Wren was just saying people will offer, especially at the beginning. How can I help? What can I do? Ask for help. I mean, it can be as simple as, hey, can you run over? Ed's barber can't come this week. Can you run over and just watch him, hang out with him for an hour while I run and get groceries? Or while I take a quick nap? I'll be here if anything happens. But can you just run over and keep an eye on him for an hour? And you would be surprised how many people want to help, but don't know how to help. And by you asking them with a very specific task, they're too happy to help you.
Great. And when I read that, that was so interesting because I guess we're on autopilot where we all go get our hair, we go out to get our hair cut, but maybe a barber would be pleased to just stop by and cut there. And if you've been their customer for many years, they're probably happy to come by your house and do that. And that is kind of nice to not have to be that day-to-day upkeep of the person role and just have their hair cut by their regular barber. So kind of nice. And that was submitted when you were talking about those caregiving duties. Another question, a comment. We live in North Carolina and we like sex. Thanks.
Well, yay. Awesome. We got to get rid of this reputation that we are prudes. So yes, awesome. Thank you.
There you go. Another comment. Actually, some of these are great. My wife still wants to sleep together, so we got a queen size adjustable bed instead of a hospital bed. Fess up note. She does sleep in the guest room a lot, but the queen size adjustable helps a lot on date night.
That's awesome.
So again, I'm not sure what stage of ALS they are living with, but as you mentioned previously, just kind of thinking outside the box, or what you would typically do to continue to support the activities you like. And that sounds, I know there are lots of adjustable queen size beds out there, probably a lot of them on late night TV. You can order anything from Amazon. Insurance may not pay for that, but for the cost, it may really support that life and intimacy and togetherness that you want to continue to have. And let's see, this is a question. Who do we really ask about this, our MD or occupational therapist?
I think it honestly depends on, I think either should be ready to help you. The occupational therapist is going to have more of the tips and the tricks, if you can think about it that way. Like your occupational therapist is the one that probably came in and said, oh, I noticed you're having trouble with your zippers and your buttons. Use this tool that you can get for $3 off Amazon, or here's one that I can give you to help with your zippers and your buttons. So asking more of a medical question, like, can we physically still have sex because we're having these muscle spasms? That might be the MD. But how do we get into a position, kind of like, can we use our adjustable queen size bed? That would definitely be an OT. And I know I'm only speaking for 3 clinics of the 6 clinics, but the 7 clinics in North Carolina, but I can say it for all of them. If we don't have the right, if you've asked the wrong person, we're not going to shame you. We're just going to get the answer for you. And I would imagine most ALS clinics are like that.
Wonderful, wonderful. And too, I know many people attend a multidisciplinary clinic, and there's an awful lot of overlap. I think, as you mentioned earlier, a lot of the allied practice folks can provide comments and ideas, whether it is to maintain your nutrition, or like maybe you should eat earlier that evening if you're planning on having a date night, or your respiratory therapist, hey, put your bi-level device or NIV on for a half hour and give yourself a rest so that you feel like you are not going to be coughing, or you've got enough breathing so you don't have increased work of breathing. So it's great to be able to reach out to anyone that you feel comfortable with on your team.
Absolutely.
Happy hour is very popular. Here's another comment. I think a lot of folks on the call are ahead of us here. We still have happy hour every Friday. He has a beer in his feeding tube, and I enjoy my Cosmos. Leading to fun, well, some fun.
That is awesome.
I guess it's whatever works. But it sounds like people are still interested in maintaining, their life, their lifestyle, whatever that may be, or incorporate, and just really looking for either 1, permission to make sure that it's not going to hurt someone, and 2, maybe just some ideas on, tricks of the trade, so to speak, with regard to making people, the person that has ALS and the other person, their partner, more comfortable. And it sounds like there are places to go to get that information. Joanna, you had a slide that had a couple of resources on that. Can you flip back and just put that on the screen very quickly again? I want to make sure that we have that for those that may be watching this recording, or for people that want to hop on that recording afterwards or view the slide deck afterwards. I also want to remind people that we are continuously trying to bring information that you find valuable. So please join us for just 1 minute at the close of the webinar for a quick anonymous 3-question survey. We appreciate everyone carving time out of what I know is a busy day for everyone. We look forward to having you join us next month for some more information related to traveling and transportation during ALS. And we appreciate you joining us this afternoon. Everyone, please have a wonderful and safe afternoon, and do join us for that quick 1-minute anonymous survey. Thank you and have a good afternoon.
Thank you all so much for having me.